Hello everyone, in this video we will be reviewing the frequently asked questions about the respiratory system. The human respiratory system includes the nose, mouth, pharynx, larynx, trachea, bronchi, bronchioles and lungs. It also composed of the diaphragm which helps the breathing. Respiratory system. Question number 1. The mediastinum contains all of the following except A. Heart, B. Trachea, C. Lungs, D. Thymus. Please think the answer. The correct answer is C. Lungs. So when you look at the picture, the area demarcated by the dotted line are the mediastinum area. So the mediastinum is the central compartment of the thoracic cavity. It contains the heart, great vessels, trachea, esophagus, thymus and lymph nodes. But both lungs are outside the mediastinum. It makes the border. So the lungs are located either side of the mediastinum within the pleural cavities and are not considered part of the mediastinum itself. Question number 2. How many lobes are in a pair of lungs? A 4, B 5, C 6, D 7. Think the answer. Okay, the correct answer is B 5. So when you look at the both lungs, you can see the right lung having 3 lobes. The upper one is called superior or upper lobe, middle one is middle lobe, lower one is lower or inferior lobe. When you take lung, upper one is called superior or upper lobe, lower one is called inferior or lower lobe. So altogether 5 lobes. So there may be other question as well. How many lobes in the right lung or how many lobes in the left lung? So you have to know that detail as well. Question number 3. Which of the following closes and seals the lower airway during swallowing? A. Alveoli, B. Epiglottis, C. Larynx, D. Uvula. Think the answer. Correct answer is B. Epiglottis. You can see the epiglottis here. You can see here the respiratory tract on the front part of the body. You can see larynx here and the esophagus on the posterior to the larynx. You can see here. So when the food comes, this epiglottis closes this larynx. You can see it closes the larynx. So the epiglottis is a leaf-shaped flap of cartilage located at the base of the tongue. During swallowing, it folds down to cover the opening of larynx and thus the trachea, preventing food and liquids from entering the lower airway. Question number 4. Which of the following allows air to pass in the lungs? A. Aorta, B. Esophagus, C. Heart, D. Trachea. It's a straightforward question. So the correct answer is D. Trachea. So when you look at the respiratory tract, you can see the upper respiratory tract is composed of nasal cavity, pharynx, larynx. Then the lower respiratory tract is composed of trachea, then bronchi, then bronchioles, and the lungs. So the trachea is known as the windpipe. It's a cartilaginous tube that extends from the larynx and branches into the bronchi, allowing air pass from the upper respiratory tract into the lungs. Question number 5. Which of the following substances is found in greater quantity in exhaled air? A. Carbon dioxide, B. Carbon monoxide, C. Nitrogen, D. Oxygen. Think the answer. So the correct answer will be answer A, carbon dioxide. When you see the composition of inhaled and exhaled air, in both nitrogen is available in greater quantity, but it is not changed during the exhalation. 78%, exhaled air also 78%. Oxygen in the inhaled air is 21%, exhaled air is 15%. Carbon dioxide inhaled air is 0.04, exhaled 4%. So it is increasing. Water vapor also is increasing. So our body takes oxygen, so the percentage of oxygen is reducing and releasing carbon dioxide. So the percentage of carbon dioxide is increasing. You don't need to memorize these percentages, but you have to know that exhaled air comprises more carbon dioxide. Question number 6. Which of the following structures is responsible for warming, humidifying and filtering inhaled air? A. Alveoli, B. Bronchioles, C. Nasal cavity, D. Trachea. Think the answer. The correct answer is C. Nasal cavity. You can see this is the nose and this is the nasal cavity area. The nasal cavity is lined with mucous membranes and cilia which trap particles, warm the air through extensive vascularity, and humidify is before it reaches the lower respiratory tract. On the other hand, the alveoli are for gas exchange. Alveoli, you can see this is a smaller part in the lungs where the gas exchange occurs, and these bronchi, and it branches into bronchioles. So these bronchioles are smaller airways, and trachea, you know that this is the trachea, The trachea is the windpipe primarily conducting air. Question number 7. Which of the following cavities are separated by the diaphragm? A. Abdominal and pelvic. B. Cranial and spinal. C. Dorsal and ventral. D. Thoracic and abdominal. Think the answer. The correct answer is D. Thoracic and abdominal. You can see in the picture, this is the thoracic cavity and this is the abdominal cavity. It is separated by the diaphragm. The diaphragm is a large dome-shaped muscle that forms the floor of the thoracic cavity and the roof of the abdominal cavity, effectively separating these two major body cavities. Question number 8. Which muscle is primarily responsible for respiration? A. Diaphragm. B. Pectoralis major. C. Latissimus dorsi. D. Rectus abdominis. Think the answer. The correct answer is A. Diaphragm. When you see the picture, during the inspiration, the diaphragm contracts and go down. During the expiration, the diaphragm relaxes and go up. So diaphragm is the primary muscle of respiration. When it contracts, it flattens and moves downwards, increasing the volume of the thoracic cavity and drawing air into the lungs. Question number 9. The mediastinum is A. Both the lungs and heart. B. A small endocrine organ behind the heart. C. A location in the chest bounded by the sternum, diaphragm and lung. D. A part of lymphatic system. Think the answer. So the correct answer is C. A location in the chest bounded by the sternum, diaphragm and lung. So when you look at the boundaries of mediastinum, you can see this is the middle part of the mediastinum. So the superior is a thoracic outlet, inferior is the diaphragm, anterior, that is frontal part, is sternum, posterior, that is back part, is thoracic vertebrae. Laterally it has lungs and pleura. Question number 10. The exchange of gases, oxygen and carbon dioxide between the air and the blood occurs in which part of the respiratory system? A. Larynx. B. Primary bronchi. C. Alveoli. D. Terminal bronchioles. Think the answer. The correct answer is C. Alveoli. So when you take the lungs, if you take the smaller part of the lung, you can see this is the air sacs or the alveoli where the blood vessels they are. It can exchange carbon dioxide, leaves the bloodstream, and oxygen enters the bloodstream, which occurs in the alveoli. So alveoli are tiny, thin-walled air sacs richly supplied with capillaries. Their structure is perfectly adapted for efficient gas exchange, allowing oxygen to diffuse into the blood and carbon dioxide to diffuse out. Question number 11. The epiglottis is a cartilaginous flap that primarily functions to A. Produce vocal sounds. B. Prevent food from entering the trachea. C. Regulate the flow of air into the lungs. D. Sense smell. Think the answer. Correct answer is B. Prevent food from entering the trachea. As I explained earlier questions, during the swallowing, the epiglottis fold down to cover the opening of the larynx, that is glottis, diverting food and liquid into the esophagus and preventing aspiration into the airway. Question number 12. The serous membrane that lines the thoracic cavity and covers the outer surface of the lungs is called the A. Pericardium. B. Peritoneum. C. Pleura. D. Meninges. Think the answer. The correct answer is C. Pleura. So when you look at the picture, you can see there are two layers of pleura. One is the parietal pleura that covers the outer surface, and the visceral pleura that covers the lungs. In between the space is called the pleural cavity. So the pleura consists of two layers, the parietal pleura lining the thoracic cavity and the visceral pleura covering the lungs. So when you look at the answers, the pericardium surrounds the heart and the peritoneum is the lines that abdominal cavity, and meninges are the covers that covers the brain and spinal cord. Question number 13. Which anatomical division of the pharynx is continuous with the nasal cavity and serves only as an air passageway? A. Nasopharynx. B. Oropharynx. C. Laryngopharynx. D. Hypopharynx. Think the answer. So the correct answer is A. Nasopharynx. So when you look at the anatomy, the pharynx divided into three parts. First part is nasopharynx, and second part is oropharynx, and third part is hypopharynx. The nasopharynx is the superior most part of the pharynx located behind the nasal cavity. It receives air from the nasal cavity and connects to the oropharynx below. The oropharynx and laryngopharynx also serves as passageways of food. So in the oropharynx and laryngopharynx, food and air also passes here, and the epiglottis divert the food into the esophagus. Question number 14. The vocal cords are located within which structure of the respiratory system? A. Pharynx, B. Larynx, C. Trachea, D. Bronchi. Think the answer. So the correct answer is B. Larynx. When you look at the anatomy, you can see the larynx include the epiglottis, supraglottis, vocal cords, glottis, and subglottis. The larynx is also known as the voice box, houses the vocal cords. These vibrate as air passes over them and produce sound. Question number 15. What is the correct order of structures that air passes through during inspiration starting from the pharynx? So there are four answers available. Please pause the video and think the answer. So the correct answer is air travels through the pharynx to larynx, then it goes to trachea, then it branches into bronchi, again it branches into bronchioles, finally it reaches the alveoli. The anatomy of alveoli is here. So the correct answer will be A. Question number 16. Which nerve innervates the diaphragm and is crucial for its function in respiration? A. Vagus nerve, B. Phrenic nerve, C. Intercostal nerves, D. Accessory nerve. Think the answer. The correct answer is B. Phrenic nerve. You can see the phrenic nerve originating from the C3 to C5 spinal nerves. You can see it here, and it provides motor innervation to the diaphragm. It goes down and innervates the diaphragm. So damage to this nerve can severely impair breathing. Question number 17. The hilum of the lung is the region where A. Gas exchange occurs, B. The trachea bifurcates, C. Blood vessels, bronchi, and nerves enter and exit the lung, D. The pleura are continuous. Think the answer. The correct answer is C. The blood vessels, bronchi, and nerves enter and exit the lung. You can see this area is called the hilum. The hilum or the root of the lung is medial indentation where the main bronchus, pulmonary artery, pulmonary veins, bronchial arteries and veins, and nerves enter and leave the lung. Question number 18. The left lung is uniquely characterized by the presence of which anatomical feature? A. Horizontal fissure, B. Middle lobe, C. Cardiac notch, D. Three main bronchi. Think the answer. The correct answer is C. Cardiac notch. So when you look at the left lung, the left lung has a cardiac notch. This is the cardiac notch, an indentation in the medial surface that accommodates the heart. So here it accommodates the heart, which is primarily located on the left side of the mediastinum. Other answers like horizontal fissure and the middle lobes, both are features of the right lung here. Question number 19. The upper respiratory tract primarily typically includes which of the following structures? So there are four answers available. Please pause the video and find the answer. Okay, the correct answer is B. Nasal cavity, pharynx, and larynx. So when you look at the upper airway, upper respiratory tract, you can see the nasal cavity, pharynx, and larynx are made of upper respiratory tract. When you take the lower respiratory tract, it includes trachea, bronchi, bronchioles, and the lungs and alveoli. Question number 20. The thoracic cage is formed by there are four answers available. Please pause the video and find the answer. The correct answer is A. The thoracic cage is formed by the vertebral column, sternum, and ribs. So when you look at the anatomical picture here, you can see the thoracic cage or the rib cage provides protection for the vital organs in the thorax and serves as an attachment point for respiratory muscles. It's composed of thoracic vertebrae on the back. So thoracic vertebra posteriorly, the sternum. This is sternum anteriorly and the ribs in the laterally. Bonus question, question number 21. The space between the parietal and visceral layers of the pleura containing a lubricating fluid is known as A. Mediastinal space, B. Pericardial space, C. Pleural cavity, D. Peritoneal cavity. Think the answer. Correct answer is C. Pleural cavity. As I explained earlier, the pleural cavity is the potential space between the parietal outer and visceral inner layers of the pleura. It contains a tiny layer of serous fluids that reduces the friction during the breathing. So these are the frequently repeated questions on the respiratory system. My channel offers guidance for the medical coding, especially to help you to prepare for the AAPC CPC examination. If you have any issues, please feel free to ask me. You can leave your questions in the comment sections, or you can email or WhatsApp me using the details displayed here. If you feel this channel is useful, please subscribe my channel and stay with me. Thank you.